this is Claire Smith, a physician assistant at Progressive Pediatrics, and today I wanted to speak with you guys about colic. So colic is a thing that we normally see that starts around 2 to 3 weeks of life and can normally go up to about 3 months of life. Now this is defined normally as a baby that's crying for more than about 3 hours per day for more than 3 weeks of time, and usually for more than about 3 days a week. There are a couple of things that we know do not really help and are potentially harmful, so I want to go over those things. So simethicone is not really thought to help. That's the active ingredient in Mylicon. Also gripe water, that's something that is not FDA regulated, and some formulations actually have been found to contain alcohol, so not something that you want to be giving to your baby. Herbal teas, such as teas that contain chamomile, fennel, vervain, they can sometimes help. However, the trade-off is potentially worse. So they are recommended to be given about up to 5 ounces 3 times a day. And if you think about how much a baby that age is drinking, you give 15 ounces of this tea to your baby. We're very concerned about the nutritional impact that that has for a 3-week-old, 2-month-old baby. So we normally don't recommend that. But there are a couple of things that actually do help, and let me talk with you about that. So the first thing that can really help are probiotic drops. You can get those off the internet. Amazon has that. So just give that to your baby every day. It helps to kind of regulate the GI system. Also, something that tends to help is switching your formula over to a sensitive formula. For breastfed babies, mom can consider changing a couple of things in her diet. So try to reduce things like caffeine intake, milk, eggs, nuts, and wheat, and see if that has any effect on your baby's colic. There's another technique actually from the happiest baby on the block. I recommend this to a lot of my patients. It's called the 5 S's. So the idea of this is to try to emulate the way that the baby would have felt in the womb. So you want to, and you kind of stack this up like a pyramid. You want to get a good foundation with the first couple ones, and then as the baby calms down, you can add on the couple ones on the top. So the first couple foundational ones are swaddling, side laying, and swinging. And then you add on the shushing or the white noise, and then the sucking with the pacifier at the end. Something else that really tends to incorporate all of these soothing techniques is wearing your baby, and there are a lot of those kind of kangaroo shirts, kangaroo carriers, get a lot of good skin-to-skin time, really helps your baby feel comforted. I want to talk a little bit about the health implications of colic. So colic itself is not dangerous, but it's the reaction that the caretakers tend to have to the colic that can be dangerous. Hearing a baby cry and not being able to do anything about it can be incredibly frustrating. And it's very important for you to realize that you're not alone in this. 1 out of 6 babies can actually have increased crying to the point where they will be brought to their pediatrician for this complaint. You need to know when to ask for help. And if you are feeling very frustrated, you need to remember that the most important thing is the safety of your baby. So you put your baby down for 5 minutes and you leave the room, take a couple of deep breaths. They are safe in their crib. So you can put them there and take 5. And I don't want you to think that you are doing something wrong or you're not doing enough, because this, for a lot of babies, is actually a normal neurologic development. And 95% of babies with colic are completely fine. Only 5% of babies actually have an organic or medical cause for the increased crying. Something to think about that's helpful are the milestones in colic and kind of what to expect. So the 6-week period, the 6-week mark on colic tends to be the hardest to get through. So when your baby is 6 weeks old, it's probably going to be at its peak. And then by about 12 weeks, it should hopefully be coming down significantly. Please let me know if you have any questions for me. Call the office and I'll be seeing you soon. Bye.